All right, first question from the waiting room.
Okay.
All right. My parents have always taken care of me, but now they're old enough where I'm starting to take care of them. They don't remember things as well as they used to, and they don't like to get out of the house much. I don't know if this is just part of getting older, or if they're depressed, or if they're having some kind of cognitive decline. How do I tell the difference? When should I seek help?
Yeah, this is one of the things I least like about middle age myself is, having to watch a parent have any, uh, health issue, where you start to step up and take care of things. I'm happy to do that part, but when it comes to the memory issues, that's very difficult because the family can often suffer more than even the parent, because you're watching a parent have like some kind of decline. Now, in the age group 60 to 70 years old, there can be normal aging memory issues, and then there can be mild cognitive impairment, which is a condition that occasionally a fraction of those people can convert to developing dementia, which is a clinical diagnosis. And dementia is typically, when we talk about dementia, it means I can't remember. One can't remember. And there's a condition called Alzheimer's disorder or disease, where it's named after a person with the last name of Alzheimer's. A lot of people call it old timers. And about 70% of all dementias are related to that condition. It's a real terrible thing because we can't really treat it that well. And then the other two types of dementias that are prominent are frontal temporal dementia. That's when a different part of the brain starts to fail, and you can have personality changes followed by memory changes later down the road. And then there's the last one is Lewy body dementia. Last one is vascular dementia. That's when folks have many strokes in their brain, and for each time they have a stroke, they have a decline in functioning. So those are the main things that can cause memory problems. It's either like normal aging, mild cognitive impairment, or one of the three conditions I just mentioned. Aside from that, though, you mentioned depression, and folks that are depressed can often have something called pseudodementia, where they look like they have dementia, but it's really just depression, lower energy, trouble focusing, trouble getting out of bed. Maybe they're more forgetful, all those things. And when anyone has depression, you have to rule out medical problems or substance use issues or medication side effects as being the cause of the depression. So that's what makes it kind of fun being a psychiatrist, is that you're always kind of doing the detective work of like, well, what's really going on with someone's brain at any one time. Now, if you're the kid of a parent who's having memory problems, either that's normal aging, and they wouldn't know probably the difference of whether it's normal aging, mild cognitive impairment, or developing dementia. And one way to get involved is if that child, middle-aged child, let's say, is involved in their healthcare, like driving them to clinic appointments. A lot of times I'll encourage the kid to go into the session with a parent who's getting like their blood pressure checked or whatever, and mention to the doctor, hey, I'm a little worried about my mom or my dad, kind of being a little bit forgetful. But one would have to do that and ask permission of your parent, of course, to do that. Now, if that's not the case, then that's tricky. And the reality is sometimes parents with memory issues will be quite defensive of it, and they will not want to talk about it. They won't want to see a doctor about it. And now and again, they have to reach a point of crisis mode where something happens. Maybe they get an offender bender. Maybe they fall, or they get lost in the neighborhood or something like that. That then facilitates the discussion of an evaluation. Now, that's if a person will not budge. And there's plenty of older folks that are just not going to want to be checked out. Like, it's kind of a scary thing to say, hey, I'm forgetful, especially in the early innings of dementia. It is not fun for the person who has it, because it's like they're losing control, and that's no, it's just a bad situation. Now and again, when a parent isn't doing well, sometimes you can have a wellness check by the police. If a parent is really not behaving normally and you think they have memory issues, and the police can sometimes take them to a hospital and force an evaluation. Here in Orleans Parish, there's a coroner. The coroner's office actually mediates this, where you can ask the coroner for order of protective custody, they call it, where you can have the police come and give them this form, and they will take your parent to the ER and have them evaluated. Beyond there, you need a doctor or two to then agree that the person needs to be admitted for further observation. And then during that observation period, they can be properly diagnosed. So that's a tough thing. And I'm not recommending everyone go out there and do this to their parents, but that's kind of how this happens for folks that are having a harder time.
What would be maybe 3 signs that you would want to step in and get your parent a little bit more help?
3 signs, you said?
Mm-hmm.
Yeah, I think if it's a safety issue, so if they're not eating or showering, taking their medication, managing their finances, that's where like older folks get taken advantage of. Someone calls them and say, hey, we're the bank, you owe us, wire me, $25,000, and they don't know the difference, Those are kind of the signs I would look for. And then of course, getting lost while driving perhaps, or if you're worried about them driving too, and they don't seem well enough to drive, that's when like sometimes you got to just take the other road and do, kind of force them to get evaluated some form or fashion. A lot of times I'll have folks come here with their middle-aged child, like a 70-year-old person with their child who's in their 40s or something, and saying, hey, my mom is having trouble with memory. So I will do the screening for them, and I'll recommend doing certain type of treatment. And a lot of times folks will do that, and they'll be grateful because they want to know what's going on with themselves. They also, if they have depression, they would rather treat that first and see how mom or dad is before doing a larger workup. Yeah, that's a complex topic. I think it's a really good question.
Okay. Well, thank you for diving into it with us.
Yes, absolutely.